Hello and welcome. This is Amanda Howell with Iatric Systems. I will be your moderator today. So that things run smoothly, I will go over a few housekeeping items before we get started. If you should need technical assistance during the webinar, you may call 978-674-8121, or you may send an email to amanda.howell@iatric.com. We encourage you to participate in today's webinar by entering your questions in the questions pane on your control panel. You may enter your questions at any time during the webinar. You may also change your audio mode at any time during the webinar. If you're using your microphone and speakers and wish to call into the conference line, please select the Use Telephone option in the audio pane of your control panel. You'll then be given a conference line number, access code, and an audio pin. It's important to enter your audio pin to enable all audio controls. This webinar will be recorded. If you do not want to be recorded, please remain muted during the question and answer session. After the webinar, you'll have the opportunity to fill out a short survey to tell us how we did. The survey will appear when you leave the webinar, and for your time, your name will be entered into a drawing to win a $100 Amazon.com gift card. And all of these drawings are held at the end of each month. I'd like to thank you for taking the time to attend our presentation, Prepare for eCQMs and QRDA Category 1. Our speaker today is Cindy Paul. Cindy, a registered nurse with over 20 years experience in clinical nursing and public health education, is a consultant in our professional services division at Iatric Systems. She is experienced in hospital compliance and quality improvement, including meaningful use and audit readiness. Cindy's primary role at Iatric Systems is clinical consulting and project management for CMS quality initiatives. And now I'll turn it over to Cindy to get us started.
Thank you, Amanda. And thank you, everyone. I'm really excited to share information with you this afternoon. Thank you for joining. We have a lot of information to cover. Much of it is very complicated, so I'm hoping that I can really break it down, make it simple, and certainly be available to answer all of your questions. So just starting off with our agenda today, we're going to talk about, is your hospital ready to start submitting eCQM reporting? What exactly is QRDA Category 1? Are you prepared for eCQM testing and validation and what all that involves? Getting your data ready for production data, and how to tackle this challenge and when. Lastly, we'll just talk about a few things about getting everyone on the same page and why that's important. So just starting out, as we know, CMS has been planning for the last few years to align quality reporting programs. Quality reporting is now moving from chart abstraction to eCQM submission. So just looking at the differences in a CQM versus an eCQM, and what exactly is that? So just as a recap a little bit, clinical quality measures started back years ago, part of the Meaningful Use EHR incentive program, with that requirement of 16 measures submitted manually. Now, within the last few years, CMS has been working to align quality reporting programs and include the EHR incentive program with CQMs along with IQR, or inpatient quality reporting programs. So this has further defined the CQM alignment with that electronic submission requirement. And I've provided a link here. If you want to go directly to the CMS website, you can get more information. I'll also be providing additional resources for you. So what exactly are the eCQM requirements for 2016? For IQR reporting, you must submit a minimum of 4 eCQMs, and you can select those from 28 measures. Report for 1 quarter of the calendar year 2016, and that could be either quarter 3, which started on July 1st, or quarter 4, which starts October 1st. Production data must be submitted between October 2016 and no later than February 28th of 2017. CQM selection no longer has to cross the multiple quality domains using the National Quality Strategy. So you can select the CQMs that are really very applicable to your hospital culture and your patient population. Lastly, eCQM reporting allows for dual submission. So by submitting electronically, you can meet both the IQR and EHR incentive program requirements for meaningful use. So how can you submit your eCQMs? CMS has outlined two different options. Option one is to submit electronically for 4 CQMs through the QualityNet Secure portal. This meets the requirement for both IQR and the Meaningful Use Incentive Program. The second option is to basically continue the same process in which you've done in the past, where you submit 16 CQMs manually, but the requirement for this year would be a full calendar year of reporting. The drawback to option 2 is that this does not align with the hospital IQR program, so therefore there's no credit offered for dual submission. All other EHR incentive program requirements, including the core objectives, those will be continued to be submitted under the Meaningful Use program in order to test and meet that complete program fulfillment. Again, there's a link on this slide that will provide you with that information to meet the 2016 regulations. So when I work with hospitals, I often get a lot of questions of, does our data have to be all intact to start the beginning of the reporting period? Does it really matter because CMS isn't looking at thresholds or numbers this year? So the information that I provide is with the current regulatory information we have, CMS is not going to report your data to Hospital Compare in 2016. So they have also said that a zero denominator is okay, but they highly encourage hospitals to select an eCQM that's applicable to their hospital population. And this also applies, whenever possible. We do understand that there are some hospitals that automatically ship AMI or stroke patients out. So, do the best that you can to select measures that really apply to your patient population. The other thing that I wanted to point out is that CMS will evaluate your data that you submit in 2016 and use that as a baseline to establish thresholds in future years. At this time, we don't know final ruling for those future years. We expect a release sometime in the fall. And we kind of joke around that CMS is really notorious about releasing new regulatory information at 5 p.m. on a Friday before a holiday. So we just kind of say, hey, keep your eyes and ears open for something probably around Labor Day. At this point, the only proposed rule that we know is that there will be some current CQMs to be retired, and 15 measures will be the requirement for the full calendar year in 2017. So moving forward, just to recap a bit, what is CMS mandating for the 4 eCQMs for IQR program? First of all, a QRDA Category 1 file format is required. They also are providing incentive for dual reporting with IQR and meaningful use. Another really good point to consider is the Joint Commission is really looking at the requirement of QRDA Category 1 submission, again, to align with CMS and align with all the quality reporting programs. And I think really a real big emphasis here is commercial payers like United Healthcare, Aetna, Blue Cross, all of those commercial payers are also looking at jumping on the same bandwagon as CMS and requiring this QRDA Category 1 as we follow in future years for quality reporting. So just putting all of these acronyms to action. I know for me, when I started out, a lot of this was very, very Greek. So I know that there are several nurses on the line. I just wanted to point out, I know remembering back for me and starting my nursing career, there was a new abbreviation or an acronym for everything. In fact, it seemed like that when I entered my nursing career, it was almost like a new world of all foreign language. So really specifically, I was thinking about this, and working as a ED trauma nurse, I'll never forget all the different jokes and songs that we came up with to remember certain protocols, like Mona. So we would always get a radio call that we had an acute MI coming in, so everyone would start kind of getting on the bandwagon and singing Mona. And I always thought that was so funny, but what exactly did that mean? So morphine, 4 milligrams, IV push, oxygen, 10 liters, simple mask, nitroglycerin, IV LR bolus, transfer to cardiac cath lab. You know the song, just kind of, following suit there. So when I transitioned to the quality role, I found that there was a whole new set of acronyms and abbreviations with relating to CMS. So clearly they needed to kind of get on the same, to follow the same suit as clinical. So let's just take a look at breaking all of these acronyms down just as a little refresher. So an eCQM is simply Electronic Clinical Quality Measure. QRDA 1 or CAT 1 is the Quality Reporting Data Architecture Category 1. You may have heard of PSVA. It's the Pre-Submission Validation Application Tool, and this is part of QualityNet or QNet. So to submit your quality data, you first have to report an eCQM, but creating the QRDA Category 1 file for that, and then follow through with the testing and validation with PSVA at QNet. I don't know about you, but that's certainly a lot of Greek to me. So what exactly does it take to produce a QRDA 1 file? So in looking with Meditech has developed a process to map certain queries and hospital demographic data to then build out the QRDA 1 reports. Now, the assumption with this is that you have followed Meditech's best practices, that there has been documentation and query build with updated value sets, and all of the correct tables are turned on to your data repository. So this all assumes that the hospital has not only followed the best practices, but also updated queries and value sets and nomenclature to meet the most current best practice, which I've noticed they are currently releasing new information on a weekly basis. So I encourage you to always refer to the Meditech ARA reporting page to look at their most recent changes on their best practices. The other thing is that, working through this process, you must make sure, you have to ensure that all of your correct tables are turned on to your data repository, and IMO must be up to date. So either you've continued with the monthly or quarterly updates that IMO has provided, or some hospitals are really considering the new IMO 2.0 ETP platform, which is a very robust nomenclature platform that really allows current and the most up-to-date nomenclature mapping. So Meditech outlines two different options to produce the QRDA. The first is using an ARA report manager. This is a tool that is used to create the QRDA. You can run reports, determine what is missing in your best practice or your workflow, go back and correct those errors, and map any of the missing data sources. Using this tool does truly require that you have followed the best practices with the most recent updates. The other option in producing the QRDA 1 file is by simply running the SQL reports yourself, whether you have internal staff that can do that or have an outside resource help you. Those are both of the ways that you can go about to create the QRDA Category 1 files. So is it really that easy? I know that that Meditech and some other vendors have said, creating this file is fairly simple, this, and you can get it done. the reality is that working through the R Report Manager takes dedicated staff. It can take several hours to weeks with people all kind of working together to review the best practices, making sure that your queries are all built to the best data capture, and making sure that your IMO mapping is up to date with the most current codes. And then the next question is do you actually have internal resources that can work within this R Report Manager tool or write the SQL reports? So if your option is to work within the R Report Manager tool, you'll go through a series of populating different parameters, mapping your queries and workflows within that tool, and that in itself will create your QRDA1. And through that process, you'll then be able to run some reports, and it will show either errors, or once everything is all reconciled, then it will show a completion. So at that point, what's next? Once you've created your QRDA Category 1 files, where do you go from there? The first step is to start the validation step within the pre-submission validation application tool. This is QualityNet's secure portal. It first requires that you have a registered account with QualityNet, and this person has to be an assigned EHR data upload role. So that person is someone that is within your quality department that has previously submitted quality measures in the past, or a new account has to be set up with the specific permissions. So that's your first step, is registration. Once you have your QRDA files, you can then start submitting reports to validate against the 2016 CMS requirements. And then working in the PSVA tool is really a two-step process. You first start with the validation step. You run those reports. You'll receive errors or warning messages. Those have to be corrected within your Meditech system. Resubmit the reports. Once you get to a point of passing your validation step, then there's a second step of actually submitting test data to CMS, again through the QualityNet secure portal. The end result of going through this process will provide you assurance that your live production data will meet the CMS standards. Now, a note here, I do want to point out that submitting your test files to PSVA does not count toward the program requirements of production data. So this is all just prerequisites to get you to the step of being able to produce your live data and submit that to CMS for your reporting period. So in reality, just to recap a bit, QRDA Category 1 is new. There are some beta sites that have tested over the last year. There are less than 20 hospitals that have actually done that. And there's a lot of new research or reports out there that provide information and kind of the struggles that those beta sites experienced in submitting data to PSVA and CMS. In looking at 2016, your tracking starts, or your reporting period starts July 1st, which were already passed. So at this point, most hospitals are really focusing on quarter 4 or October 1st. And that reporting has to be submitted by February 28th of 2017. Bottom line, this involves a lot of new build and IMO mapping in Meditech in order to meet those best practices. You have to first test the QRDA files before you can submit, and there's a tight timeline that we're up against with that October 1st deadline. If you don't follow these, there are penalties. If a hospital does not attest with the 4 eCQMs, they fail inpatient quality reporting. They can incur a penalty of an annual market-based basket increase. They will also incur penalties for meaningful use. And hospitals with large Medicare claims, these hospitals could face millions and millions of dollars of loss. So there really is a lot on the line whenever you're looking at eCQM reporting. So Iatric Systems is here to help. We really say don't go at this alone. We understand that hospitals are managing multiple projects. Folks are wearing numerous hats within the hospital and various departments. And so we're here to help in any way we can. There's just too much on the line to not meet these requirements. So Amanda, before I start talking about the service offerings and how we can help, have we had any questions that have come in the chat at this point?
We sure do, Cindy. We have 2 questions, and before I get to those, I just want to remind everybody that if you do have a question, please enter it in the questions pane on your control panel. The first question is, what is the ARA Report Manager, and where can I get more information?
Okay, Amanda, that's a great question. So the ARA, or ARRA Report Manager, is the tool within Meditech that I mentioned. It is for customers to go in, install it on the data repository server. They can set up parameters and map specific CQM queries. At that point, they'll be able to create their QRDA1 files. So this tool is something that Meditech created to assist their hospitals to create that QRDA Category 1 file. Now, just something to point out, the prerequisite for this is that you have to have followed the most recent best practices, and this often can require new build and workflow changes. Anything else, Amanda?
Yes, we do have another question. What is needed to start testing with QualityNet?
Okay, another great question. So like I mentioned, there must be a designated person who has a QualityNet account set up where they have the established permissions set up in order to submit data for quality reporting. I'm finding and working with clients that this is typically someone within the quality department who has been submitting quality measures for years. So it's not necessarily a requirement that someone new set up that account. There typically is someone within your hospital that will already have this established.
Okay, we've got a couple more that came in. Do you need their ARA file if you are using a vendor for submission?
It depends on your vendor, and so I would just refer you to that particular vendor. Every quality or every analytics vendor is doing the process differently. So I know that if you're looking at submitting reports directly from Meditech, you do have to install the ARA Report Manager and go through that process to create the QRDA1.
Okay, and our next question is, does the ARA Report Manager help troubleshoot what is missing before creating the QRDA Category 1 file?
Yes, absolutely. And that's one of the things that I really like about the tool is you may think that you have followed the best practices and that you've got everything all in place. But once you populate those parameters and run the specific report, then it will pop out with errors of, what's missing. And it will tell you exactly, either there's a table within your DR that's not set up correctly, or you don't have the most recent value set mapped, that type of information. So it is labor intensive, I will say that, and can sometimes be frustrating because you assume that you wouldn't get any error messages back because if you have all your best practices in place. But those error messages are very specific in what's missing and what you have to go back to make that remediation.
Okay, Cindy, that's all at this time.
Okay, thank you. So let's move on and just talk a little bit about how Iatric Systems can help. I know that there are some folks on the line today who have already contracted with our professional services. So I'd like to say thank you, and I hope that this will just provide additional information and details about what our service offerings provide you. So how can we help? First of all, our professional services and Iatric systems as a whole, we have experience in CQMs and very clinical specific information about how you can change your workflows or make your workflow work specific to your hospital culture. We are experts in CMS regulations and eCQM requirements. And I think one main thing about Iatric systems and our professional services is we know Meditech. We have report writing expertise. We have clinical analysts. We're really able to help you design new workflows or build queries, whatever is needed to meet your hospital requirements for your culture, but also meet those best practices. And lastly, Iatric systems, as you know, many of you on the line have had our Meaningful Use Manager product for years, and now you're in the process of converting to Analytics on Demand for your quality reporting. So we're really excited about Analytics on Demand and the much more robust solution that it offers for not only your meaningful use and quality measures, your CQMs, but other quality endeavors that hospitals are facing today. So just to talk a little bit about what our professional services offerings are. We have a data analysis for QRDA Category 1. This process starts out with working directly with the hospital to select 4 eCQMs for 2016. We will perform a gap analysis to compare your current data collection against the Meditech best practices and the CMS specifications for 2016. From there, we provide recommendations for remediation. You'll have a report that will direct you with all of your gaps or places where you're not meeting best practice or the CMS spec. You'll then have all the information that is required to go correct those gaps or remediate the issues. And we can also provide you with guidance in creating your QRDA-1 files. We've been working with sites for the last several months in working in the R report tool, so we know some of the very common error messages that are coming across. So though it would be your responsibility to create those QRDA files, we're very familiar with that tool and particular error messages. So we can certainly help with guiding you through that process. Now, if you're having issues, there are some sites that don't have a data repository or really don't have the internal resources to work through our report manager, we can also assist with our report writing services. And with this, our report writers will go directly into your Meditech system and write out the NPR reports that are required for your 4 eCQMs. And from there, you'll have your QRDA-1 files readily accessible. Part of this service also includes working through the testing and validation with your PSVA tool, submitting those reports and helping you work through the errors and correcting all of that so that the end result is we get you to your October 1st reporting deadline so that you're ready to go with live production data that meets the CMS specifications. Another service offering that we have is what we're calling QRDA Assist. This is very specific for hospitals that either don't have data repository or they just really need some deep down assistance with creating the QRDA, whether that be through just the SQL reports or the report manager. So again, we would offer the gap analysis, work with you in selecting your 4 eCQMs, really specifically analyze your data integrity, write those reports, and again, follow through with the testing and validation with PSVA. Now, the benefit for this service is you don't necessarily have to be looking at Iatric Systems Analytics on Demand. We are offering this service for other quality vendors. So if you are using Truvin or Quantros, Acmeware, or Medisolve, those are all vendors that we're able to help you produce your QRDA-1 files for, and then you can then take that to your quality vendor. So I just really wanted to emphasize the importance of there are really tight timelines that we're up against right now. As I mentioned before, the financial penalties are huge. It's not just for IQR, but also for meaningful use. So you don't want to delay at all because there will be financial penalties. So what can you do to be ready? My recommendation is to align your frontline clinical staff and your quality folks together immediately. This may have already been done. It's also important to bring in your IT folks. Everyone needs to be on the same page. You can make sure that you're implementing your new workflow changes. If there's any new build requirements, offer training to your staff as soon as possible and get those new workflows implemented so that once you come to your October 1st reporting period, that's not new. Staff aren't trying to get on board at that time. You've already got those workflows established so that your data will all be intact to start your reporting period. Also, adopt a hospital culture of continuous quality improvement. So this may involve establishing new departmental teams, again, aligning teams with quality and IT, getting everyone on the same board, and unfortunately, this does include bringing on those physicians who have, somewhat been resistant or have refused to get on the same bandwagon with EHR implementation. So get creative with offering different incentives and what you can do to get staff all on the same board. One thing that I just wanted to make note is clinical nursing has evolved so much in the last decade, let alone over the last 50 to 100 years of our careers. So I just wanted to say that it's difficult. It is. We all know how difficult it is to meet these red tape requirements. And so the bottom line is our goal is to deliver the highest quality of care to our patients, but we, at the same time, unfortunately, have to meet these quality regulatory reporting. And so how can we assist to meet those and help you out? So just the last couple of things I wanted to just mention about how can you get these programs in place and pull everything together. So just a couple of questions. How do you approach your quality improvement programs? How are you measuring your performance? How are you evaluating what physicians are on board and what physicians are documenting the requirements, or are there physicians that you really have to focus on to kind of bring them up to speed? The emphasis really does need to be on continuous quality improvement. And again, use incentives in a very creative way. There's nothing wrong with providing a snack basket or a gift card to the coffee shop. Those are all really good incentives to say, hey, thank you for helping us to meet these requirements, because the financial penalties are so large that we all have to be on the same team. Another thing I wanted to just mention is it's very important to just align your C-suite, quality, IT, and all clinicians all together for the main focus of being our patient-centered care, and that will impact change in overall quality. Lastly, I just wanted to provide a slide here with different resources available to you. The first is the CMS regulatory page for the EHR incentive program. There's also a link here for electronic clinical quality improvement, or the eCQI website on the eCQI link for health IT. And then also QualityNet has a lot of great information regarding eCQMs. They have some webcasts recordings that you can listen to, and they really dive deeper into the eCQM requirements and submission and how to go about using their PSVA tool. So with that, Amanda, what other questions have we had come into the chat?
Okay, Cindy, our first question is, how long does it usually take to create QRDA Category 1 files and complete testing with QualityNet?
So that's a great question. The process can be quite lengthy, and at this point, there really are tight timelines that you're up against if you haven't started the process. The first step is to just make sure that the workflows are in place that meet the Meditech best practices, and that you are working to create those QRDA1 files either within the R report manager or having SQL reports written. So that piece can take 4 to 6 weeks, depending on your department teams and everyone kind of being on the same page. Once those QRDA files are created, then you can start the validation and testing part with PSVA. I have found in working in that testing step, that can take as much as 4 to 6 weeks as well. So at this point, it's really essential to get started if you haven't already. And I'm working with several hospitals that are really in different steps of the process. So those hospitals that have followed the Meditech best practices, or are currently looking at and making changes, those hospitals are really a step ahead in getting to the PSVA testing piece. Anything else, Amanda?
That is all. I think you've covered it well.
Thank you so much. I know it's very complicated stuff and very new to everyone. To vendors and CMS, it's a very new process for everyone involved, and I'm certainly here to help in any way I can. So folks, please feel free to reach out to me. My contact information is listed here. I'm happy to answer any questions, and if you want more information about our services, then I would be really happy to have a deeper dive with you on that.
Okay. I would like to thank everyone for attending our webinar today. Just a reminder that you'll have the opportunity to fill out a short survey to tell us how we did, and that survey will appear when you leave the webinar. For your time, your name will be entered into a drawing to win a $100 Amazon.com gift card, and all of our drawings are held at the end of each month. Please follow us on social media and our blogs for healthcare IT updates and to interact with your peers. If you would like more information, please contact your Iatric Systems Account Executive or send an email to info@iatric.com. I would like to thank Cindy, and once again thank everyone who took the time to join us today. I hope you have a great day, and this concludes our webinar.